There is something very beautiful about the origin story of the NHS. This history of the country coming together after World War II and effectively deciding that if you're sick, if you need medical treatment, then you will receive it, even if you can't afford to pay for it. And that makes the present state of the NHS even more depressing.
This is an NHS not just in crisis, but in what one person described to me as a polycrisis across the whole system, from GPs to hospitals to mental health to social care.
In May of this year, you had 7.6 million people on the waiting list for elective surgeries. There are currently 25% of A&E patients having to wait more than 4 hours for treatment, and a shortage of more than 100,000 doctors and nurses. It's tempting to imagine that these problems can simply be solved by a change of government. But the NHS is currently suffering from two big structural problems, and neither of them have easy answers. The first one is simply the rising number of elderly people that the NHS has to care for. The fastest growing age category in the UK is people over the age of 85, and within 15 years it's expected that about 20% of the entire population will have reached retirement age. In British politics, the standard response to any difficult problem is just to throw more money at it. But the UK has had extremely weak economic growth for a long time now. GDP per capita is now in 2024 still lower than it was in 2007 before the financial crisis, which effectively means that from the perspective of the average person, the country has now had negative economic growth for almost 20 years. This has many bad implications. One of them is that it has become effectively impossible for any politician, Labour or Conservative, to fund large increases in NHS spending. What this means is that the only serious strategy for fixing the NHS is going to involve a combination of finding new methods of providing healthcare in a less expensive way and actually growing the economy. Out of everyone in British politics, the only person who I've seen actually acknowledge the extent of the problem and also actually try to articulate a genuine strategy for how this problem might be solved is the former Labour Prime Minister Tony Blair. It's been almost 20 years since Tony Blair stepped down as UK Prime Minister, but he's still one of the most influential people in Britain. And in the last few years, he's been working with a team of advisors on a policy vision for the NHS that is quite radical.
There is only one game changer. In our view, that is harnessing effectively the 21st century technological revolution. We are living through a time of huge advance in medical science and treatment. All of it accelerated by artificial intelligence and the application of AI to data.
The key medical outcome that AI might enable is a shift towards proactively diagnosing and then giving treatment for medical problems before they reach an acute stage. This would be better for patient health and also less expensive for the NHS because of the reduced demand for complex medical treatment and expensive hospital visits. This is a clip of Tony Blair talking with Demis Hassabis, who is the co-founder and CEO of Google DeepMind.
It should transform drug discovery and development, right? Create kind of digital assistants, right, where a doctor or a nurse is able to call on all the accumulated knowledge. Thirdly, for the patient to have access to information, not just their own health information, but the potential for treatment, right?
Of things like personalized medicine, where you potentially design a drug or a treatment that's specifically tailored to an individual's metabolism. And then the other big thing, I think, is preventative healthcare, where you actually predict beforehand before someone gets ill, or maybe they're about to get ill, and perhaps you intervene beforehand, which is a much better outcome for the patient, and also potentially economically as well.
Any serious attempt by the NHS to integrate AI into its service model will require extensive collaboration with the private sector. Most fundamentally, there will need to be a national public health data infrastructure for the training and fine-tuning of AI models. And Tony Blair's argument is that instead of seeing this as a economic cost, the UK should instead see this as a golden opportunity to give its life sciences industry a powerful competitive advantage in the global economy. Transformative economic growth of the kind that would allow the UK to fund the NHS properly is only going to be possible if the UK becomes a place where our tech startups can grow into some of the biggest companies in the world. And a British national health data system could be a critical advantage. That's because the NHS has the potential to develop what's called longitudinal healthcare data, and to do so at a national scale. The NHS is unusual for having such a nationalised and centralised healthcare system. This effectively means that it can create a healthcare data profile of someone from cradle to grave, and therefore come to a much more holistic understanding of how different healthcare treatments affect people over the course of their lives. To say it in just one sentence, the NHS could be a catalyst for the world's best medical AI ecosystem. This idea of using the NHS as a commercial data asset is going to be extremely controversial, and some of these concerns are rational. Any kind of AI strategy for the NHS is going to be predicated on effective data governance, but this is something that the NHS has often struggled to achieve. It was only in March of this year that patient details, which were meant to be confidential, were leaked on the dark web. And there have been many examples of technology procurement contracts that have gone badly wrong. Back in the 2000s, there was a catastrophic rollout of an IT system for the NHS that wasted billions of pounds. And even if you assume competence, there will still be a constant tension between the time and resources required to align the NHS around this goal of making it an AI data platform, compared to spending every last hour and every last penny on responding to the challenges that the NHS is currently facing. Turning the NHS into a world-class data platform is an extremely ambitious project. To have any chance of being successful, it will have to be a top strategic priority, both for NHS leadership and at the very top of British government. I'm reminded of the Michael Porter dictum that strategy is about choosing what not to do, which is to say that this project would have to be something that gets prioritized quite ruthlessly. That's going to be difficult, but maybe this is just too important for us to accept that the UK can't do difficult things well. Difficult things like secure data governance, intelligent procurement, and effective prioritization, because the risk of not doing something bold like this is further decline in the quality of the NHS and Britain's economic stagnation.